American Heart Association is raising some concerns about women and heart disease. A new study showed just 44% of women are aware that heart disease is the leading cause of death. That's down from 65% in 2009. This lack of awareness rose the most in women ages 25 to 34 and among women who identified as Hispanic or non-Hispanic Black. The American Heart Association says they need family doctors, obstetricians, and gynecologists to educate younger women about risk factors they may experience when starting a family.
A lot of risk factors that occur during one's pregnancy or adverse risk factors such as gestational high blood pressure, gestational diabetes, something called preeclampsia, where your blood pressure becomes very high and you spill a multitude of proteins. Those are actually risk factors for women in the future to have underlying cardiovascular conditions.
The American Heart Association says women need to be aware of symptoms that may indicate a heart attack, but could be mistaken as something less severe. Those include shortness of breath, jaw pain, nausea, vomiting, and indigestion. The association also wants women to be aware of less common risk factors for heart disease.
Heart disease is an inflammatory process. So if you have underlying inflammatory conditions such as autoimmune disease like lupus or rheumatoid arthritis, for example, or even inflammatory bowel disease, that can put you at a higher risk for heart disease.
The American Heart Association says 80% of risk factors are preventable. Those include obesity, diabetes, smoking, and alcohol use.